Massive thank you for everybody for their time, for joining today. I'm really delighted you could do so. As I mentioned, this is one of the broadcast group events for the PRCA, so it's a broadcast focus, but it's a healthcare special today. As I mentioned, we're going to be providing a quick update on the broadcast landscape in 2021. So who's watching what, who's listening to what, how and where. But then also we're going to move on to look at the kind of radical shift towards perhaps more innovative broadcast consumption tactics. And by that, I'm talking about virtual events and live streaming. And so specifically how the healthcare pharma sector is engaging with healthcare professionals, the wider consumer audience, media, employees from a remote capacity. I'm going to be looking at actually whether or not those techniques and tactics are going to stay, or potentially are we going to just revert to the norm that was pre-pandemic. I'm delighted to say I've got, as you see, a panel before you who are expertly placed to discuss this today. We have Rachel Royall, who is Director of Health, Wellbeing and Life Sciences at Markettiers, and previously held senior roles in central government, NHS Digital and IBM, where she was Comms Director of UK Healthcare and Life Sciences. Rachel, thank you so much for being here today. In addition to Rachel, we've also got Mark Seymour. So Mark is a director at FleishmanHillard and a healthcare specialist. He has extensive UK and international experience working with big pharma, biotechs, NGOs and government bodies across a range of therapy areas. And last but not least, we have Howard, who is founder of Markettiers 4DC, a group of companies at the forefront of innovation in PR and communications across radio, television, as well as online platforms. Howard, thank you for joining us today. I think if we could kick off, as I mentioned, by perhaps speaking to Howard and Rachel about broadcast consumption habits. How have they been impacted by the pandemic? I think personally, working from home means that I'm getting up a little bit later than I used to, so I'm listening a little bit later to breakfast content. I have to admit, I probably should be out running or learning a new language or something, but I'm actually just having a bit of a lie-in. But I'm actually listening to more radio perhaps throughout the day for a combination of different reasons, whether it's to get information, check the news, or as a distraction to focus on some work. So is that reflective of the wider audience? Perhaps Howard, if you could kick off with this, and have we seen viewing and listening habits change at all over the last 9 months?
We are certainly reflective of the 18 to 24-year-old age group, Dan, from a Radio 1
First time in a long time, that's been the case.
I mean, Radio 1's peak listenership of Brekkie has moved from about 7:10 between 8 and 10 in the morning now, because that age group are certainly having a slightly longer lay-in. Either that or they're going for a rundown and then they're coming back and then listening to the radio. But COVID and the pandemic and remote working, there's a number of reasons why it's had a positive impact in terms of TV and radio consumption. Radio, first of all, the general headline across almost every station is the reach is growing, and very importantly, listening hours increasing as well, which basically means more people are listening and they're listening for longer. For the simple reason they are working from home, there is no commute. And we were expecting a drop off even in podcast consumption, because prior to COVID, everyone, the boom everyone was perceiving to be was during the commute. But actually, a key part of the reason why the numbers are strong is technology and platform. And actually, 1 in 7 homes has got a smart speaker. Most people have got Buzz, Bluetooth, linked to smart. And so if I give you some specifics as well as the general bit. So LBC, in the last 11 months, its reach has gone up 43%. It's 2 million reach now. Hours up 17%. Big numbers, big real numbers. They didn't start from a small base. And it's almost on a par with a Good Morning Britain kind of size of impact, because it's a 24-hour based speech-based radio station. And obviously, if we can remember 11 months or nearly 12 months ago when the pandemic first hit, and the fear and the lack of knowledge, the lack of information, and people were listening to LBC because it was a conversation, it was a debate, and it's done very well through that. But then, interestingly, if you look over the transitional periods of the last 11 months and our confidence of understanding what's going on, what the pandemic is, and the effect on us and the economy and healthcare and everything else, actually you've seen the likes of Global and Bauer, which offer a bit of escapism in terms of listener habit. Yes, we need to know there are duty bound as broadcasters to give us news, but after a few months, look, I could do with a bit of escapism. And so a lot of the music-based stations, the younger-based stations, have seen a boom for the reason that people want the escapism. So
that's interesting. I think when we've looked at, for example, the Rayjar results historically, so Rayjar, the measurement body, which looks at who's listening to what and for how long, they release quarterly figures. They've not been able to do so during the pandemic because of the way they actually carry out their survey, which is a little bit archaic. But historically, when we've seen those results, one station's gain is normally another station's loss, because the audience stays pretty consistent, very high, but they might move to a different station or for different amounts of time. Are you saying that the consumption is generally up across the board and people are still listening to music-based, they're still listening to speech-based?
Yeah, it's marginal. We're talking about having started from a base of 48 million people a week listening, or 45. Yeah, so it's not as if it's gone from 30 million to 50 million. So a small percentage in the total. I said LBC's done, and LBC's taken, if you look in Times Radio, BBC 4 and 5 Live, I've seen a slight shift. It'd be interesting when the Rayjar does come out, but the key part being is, radio's success for decades is its portability. It's not intrusive. The chief executive of iHeart talks about it as companionship. I'm sat here in an office rattling around in 10,000 square feet. I've got smooth radio on for company. Otherwise it's a big building with just white noise rattling around. So the companionship, and again, if you, over the piece of the last 7 months, the BBC have done Local Heroes campaign. They've recognised how actually radio in communities has become really supportive for a lot of people who have been isolated. Radio is there. It's in the home. They're used to it. They trust it. It's their friend. It sounds quite cheesy, but it's true. For an awful lot of people, radio is companionship. And so, if you break down why if you look at every station's numbers, why they're doing well, each one has a slightly different nuance as to why they're doing well. Hyper-local radio has boomed over 20%. That's where people are listening to very, very local radio. Quite simply because people want to know what's happening that's going to affect them in their local area. We have federal government, but regional lockdowns. So people might be interested in national news, but they want to know local. And and that bleeds into TV, Dan. If you look at one of the biggest stats I've did surprise me with the size of it, was that the BBC regional evening news bulletin at 6:30 reaches, I think it's over 30% of the population in England. And if you add in the lunchtime and the late evening bulletin, 46% of the population in England watch BBC regional news bulletins. So it's not the national news bulletins that's the hero anymore. If you're trying to mobilise behaviour, and that's because provenance in terms of our consumption habit in broadcast is absolute. Yeah, I know the national news agenda because I see it every minute of every day. But the bit that I'm very interested in is the bit that affects me. And that replicated around the country in both radio and TV consumption is why we've seen the numbers we have. And the only other thing to add in the technology space is that actually BBC Sounds, you would have noticed, or you may or may have noticed, but BBC Sounds the last few months is now the destination that the BBC is using to drive listeners to actually consume live radio. And so the stat that amazed me was that 65% of total listening hours on BBC Sounds is live. Yet the perception is it's all podcasts. You think about the marketing historically, with Peter Crouch and the G-Sig, but the BBC were heavily promoting Sounds as a podcast destination. But 65% of all hours is live. 55% of total plays is radio. So what people are realising is I'm sitting at home, I'm working, I've got a smartphone, I've got my buds in. Actually, I use Sounds to consume my radio. It's still to compare, but the technology for me is the bit that's meant that, yes, it's as well as having great content, the ease of access through technology, I think, is a key reason why it's done so well.
That's interesting. I think, for anybody old enough on the event to remember, video was rumoured to kill the radio star many decades ago, but actually it didn't. And the fact that technology still is being used to maintain radio's popularity and success. Just
it's the first video on MTV, Dan.
Wasn't it? Yeah. Careful, we're gonna show our age here. I'm still clinging on to that 18 to 25-year-old comment at the start. I'll hold on to that. So, Rach, I want to bring in you here. So, thank you for that, Howard. I think that obviously what we heard there is that obviously radio and TV is hugely important as a source of news, but also from a companionship point of view. And I think the companionship piece is really powerful. We probably heard broadcasters reading out emails or tweets they received from people who really thanked them for their company during the last kind of 9 months or so. Thinking about healthcare during this time and how healthcare pharma have maybe used broadcast channels effectively or not, how important has broadcast as a platform or as a channel, media channel been, Rachel, to the healthcare space in that period from your point of view?
Thanks, Dan. Well, I think it's been huge. There've been so many standout visual moments in the last 12 to 18 months, and we can all kind of remember them in our head, you know, from government briefings, Nightingale hospitals, clapping on doorsteps, vaccination announcements. Healthcare's been, I guess, at the centre of world affairs. So by default, that's meant that it's absolutely at the centre and at the heart of broadcast media. And I think there's 3 reasons why broadcast media, I think, has been so relevant to healthcare, or 3 kind of broad themes which I just touch on. The first, building on what Howard has already said just about the, you know, the kind of the broadcast gain, if you like, that we've seen, is around trust. We've seen people obviously being skeptical about information that they get via social media. However, the statistics kind of show that people lent towards the BBC, for example, as a really trusted source of information about healthcare. So 68% of people agree that radio is a trusted source of news, and the Havas media research shows that 64% cite the BBC as the most trusted channel, 64% citing that it is factually accurate, compared to, I think it's 15% for The Guardian, for example. So people are trusting broadcast media. And I guess with that, we've seen that what's kind of been dubbed this fame prescription. So, you know, the rise of the celebrity doctor throughout. There's been a fair few celebrity media medics that throughout this period we've seen, you know, they've probably got a whole second or maybe third career on top of their kind of Love Island or Strictly gig on top of this, you know, supporting government campaigns, supporting pharma companies, supporting charities in some of their awareness campaigns throughout the period. And then the second theme really is around action. And I've got a couple of small kids. Howard kind of suggests that it's normally about 20, but I just have 3. But for those of us that have kind of reverted to, you know, the Joe Wicks workout when school went off, you know, broadcast media, actually, it's inspired a generation of people to act and to actually change their physical habits and to do something. And for anyone that works in public health, we know that behaviour change is absolutely critical, and broadcast media throughout this period has kind of proven its worth in that regard. And I think the third thing for me is around stories. The NHS, and we've had the privilege of working on quite a few of the Cabinet Office and the NHS and the public health campaigns, but the NHS strategy was to show, not to tell. So they didn't want to tell people to have their vaccine, they wanted to show people the stories. So we saw Maggie Keenan, who from Coventry, have her vaccine, and we all know that kind of when you see something and it's someone that you can relate to, and the relatability of that you're more likely to take on that action yourself. Now, whilst that, I guess, has been on steroids throughout this period, there are a whole load of lessons there about the value of broadcast communications that you can see throughout the whole of the healthcare landscape that will continue.
That's fascinating. I think in the trust you mentioned as well. I'm just, I'll drop something in the chat box, which is a new report which I saw come out today, which again was just looking at kind of how trust gets eroded across different platforms. It was a specific report out from the Centre for Countering Digital Hate, which is highlighting the amount of misinformation regarding COVID vaccines, the risk of coronavirus more broadly, which was put out by this centre. I'll share that in the chat just for people to maybe look at later or today. But I think it's that trust that we associate with broadcast media which makes it so powerful. So thinking about that again from a healthcare pharma perspective, do you have any particular proof points? Appreciate you might not be able to go into specifics of a certain brand, but have you got any proof points where you've worked with a brand or you've seen a brand that really effectively used broadcast channels to deliver a certain call to action or awareness raising metric?
Yeah, thanks, Dan. One of the things that we've done via our research arm is we actually have done a little bit of research as well into kind of how broadcast media is used in healthcare. And it's, you know, 2 in 5 UK adults learn about mental health and well-being by listening to the radio or watching TV. 37% receive information about exercise via broadcast media, 24% about nutrition. So there's lots of evidence that suggests that people will obviously use broadcast media to act in the space of kind of health and well-being. But I guess importantly, after hearing a health topic on air, 1 in 3 people said they'd search for more information online, 1 in 8 have asked their GP for more information, and 1 in 10 have downloaded a relatable app. So for those kind of people, you know, on the call that I guess are working with brands and that are working with clients that have things where there is a direct kind of call to action, we've certainly got an evidence base there which suggests that broadcast is a key player in helping people to act, change behaviour, and part of the broader mix. Last week we were involved in a fantastic campaign. We were kind of contending with Budget Day and all of the attention around Prince Philip and all of the royalty, but what we were able to do last week is work with the World Obesity Federation, and we were able to cut through the media noise and to get global broadcast media coverage for a campaign where not only did we see, obviously there's lots of coverage, which is our output, which is fantastic, but kind of an outtake for that, if you like, was the Google media trends, where we were actually able to see a spike in searches. We were able to see that actually there were lots of online conversations, and there was a huge increase in online conversations, not just around the campaign, but around the spike. So lunchtime news, evening news, we saw increases when America came online, and we could see the trends actually throughout kind of the globe, which was quite fascinating to see as part of the evaluation package for that. So there are definite proof points, and I think when we work on a broadcast media campaign, what's important is that we group what we do in broadcast alongside what we're doing in print to measure the whole impact of a campaign on the behaviour that we want to see changed, or the awareness that we want to see uplifted.
That's great. I'm sure there'll be questions about that perhaps when we get to the Q&A later, and I want to make sure we have time for that. So I'm going to pause the kind of focus on traditional broadcast for now and switch our attention a little bit more to the kind of more nascent broadcast tactics, and actually how audio and video is being used to engage with audiences through virtual events or streaming. So I want to bring in Mark and Howard here. Mark, thanks for joining us. Specifically with healthcare and pharma in mind, has the virtual media briefing revived the press conference? Like, has the virtual event brought back an event which was kind of dwindling in terms of how often they were taking place and the relevance of them? Have they revived the relevance of the press conference?
Yeah, I think that's a really interesting question, and it's interesting to hear Rachel talk about trust, because I think, you know, I come very much with a pharma background in terms of my whole career has been working with pharmaceutical companies and consulting them from a communications point of view, and certainly the trust that pharma has kind of never been that high. It's always had a bit of a PR problem, for want of a better word. And what we've really seen with COVID is it's forced pharma companies to really engage a lot more with broadcast platforms that we wouldn't have seen otherwise. I think, you know, a lot of what Rachel's been talking about, you know, has really forced pharma companies to kind of come out and confront some of their fears, and the fears around, you know, compliance and what you can and can't say, and medical legal, you know, forces are very strong. And certainly from where I'm sitting at FH, you know, we've seen an explosion in terms of press conferences. I mean, I would say probably 5 or 6 years ago we really started to see them kind of tail off. And then in the last 12 months, we're seeing a lot more appetite, which in my opinion is a good thing, because I think the good thing about a press conference, just a, you know, bog standard traditional press conference, is it's very open. Howard or Rachel talked about, you know, the PM briefings and things like that with Number 10. And that we're certainly seeing just giving journalists and pharma a bit more of an interface where they can, you know, communicate and engage, and using the online platform, the virtual space, I think is such a good thing to come out of what has been an awful pandemic for a lot of people. So, I mean, that's from a pharma perspective. I think just you know, from a media perspective, and I know this is incredibly obvious, I think just the convenience of it, what we're seeing is that whereas before, you know, without being too blunt about it, there was a bit of a hustle to get journalists to come to press events, and they were quite expensive. And in the pharma world, they were normally at medical congresses, which were in far-flung places. And obviously, with the advent of kind of online and publications getting less and less money and funding and so on and so forth, we were seeing a real decline in audience attendance. And now we're seeing an explosion, just the convenience of it. And from a pharma perspective, you know, the clients are happy because they're getting the targeted outlets that are really speaking. You know, if we're doing something in rheumatology, we're getting the rheumatology outlets, the niche outlets that don't have the money to fly to X, Y, or Z, actually attending. So it's a really good return of investment from their perspective. And I think the third thing, a fifth thing, I can't remember how many things, but is really, it is getting the spokespeople as well. And I think the convenience of having people being able to dial in different time zones and so on and so forth just means that we're finding that you can get a much higher caliber spokesperson because they can just pop in 45 minutes and pop out, and there's no having to travel anywhere. So in a short one-word answer, definitely.
No, I think that's fascinating. I think there's, as you say, there's certain efficiencies to it, which may have previously been seen as maybe a shortcut, whereas now are seen as a real benefit or a merit. So actually you can, rather, if you're hiring a venue by the hour, then you're perhaps trying to communicate to too many different people at the same time during the limited time you have that venue for, whereas now you can segment your audience, presumably, based on specialism and or location, I guess, and or language. So what for any of the viewers on here who may be considering putting their own event on, or their own virtual press conference, I should say, before we start to bleed the two, events and press conferences, what are the kind of key considerations they should have in mind before doing so or when doing so?
Yeah, I mean, I think in terms of format and content, I think it's exactly the same. I think keeping it short, keeping it sweet, having a good range of spokespeople in the healthcare spectre, just having clinical patient spokesperson, having a pharma spokesperson. So the good range is really important, really good moderator. All of those things that you would have as a normal face-to-face live event, I think are really important. I think what's different is, and what surprised me was thinking that actually a virtual or broadcast event was going to be a lot easier. So even though there's the convenience for the attendants and the attendees, actually the logistics behind it, making sure it goes well, making sure it's right, making sure that the spokespeople are briefed and so on and so forth. And in terms of budgets and, you know, when we're putting together, you know, proposals for our clients, they're not actually that much cheaper, considering you're not hiring, to your point, Dan, like, you know, venues and things like that. They aren't as cheap as you would have thought. So that I would say those are the main things. So range of spokespeople, short and sweet, and then if you're working in agency, just making sure that you don't just assume that the budget is going to be, you know, you're shaving off lots because it's virtual.
Yeah, good tip, good call out. And Howard, perhaps if we could bring you in here. Actually, you've been championing live streaming for over 15 years now, I'd say, and been at the vanguard of virtual events in recent years as well. And I think we probably need to make a distinction between those two things. I mean, this is a Zoom event. Is it a virtual event? Is it a Zoom chat? Is it a panel event? Kind of a blend of a mixture of those, but actually there's a risk of using shorthand language inappropriately. And to Mark's point, then maybe giving a client the impression that it's going to be cheaper when actually the budget maybe goes into other things. So maybe if we could bring you in here and tell us first of all about how maybe the pandemic has affected the adoption of tactics such as live streaming, and also just tell us a bit about maybe what you've been working on over the last year or so.
Yeah, I mean, first of all, thank you, Mark, because you're absolutely spot But it's very, the change has been logistics driven. And I think 12 months ago, people were migrating into it as a distress need. There was a physical event was going to be put on, got canned, moment, what do? They moved to virtual as a distress purchase. And I think what's been interesting is the adoption is now, because it's been tested, proven, and for a number of the reasons Mark mentioned, plus also, for big corporates, sustainability, sort of corporate governance, sustainability, green creds, and actually, as soon as you start getting data points come out the back end and metrics that show engagement levels are greater, suddenly it's an event. It just happens to be served through virtual platforms. And so, listen, the first live stream we did was just under 20 years ago on a 256K modem dial-up connection with the little blue bar going across the bottom on a refreshing webcam. And things were very different. Whereas the evolution now, this is Zoom. The adoption is because video conferencing capabilities with a little bit of zhuzh has suddenly made Zoom, it's like a Hoover doing a Zoom call. Even if it's on Blue Jeans or WebEx or Power People, Zoom is kind of the phraseology. But the reality, to Mark's point, the adoption has shifted over the last 11, 12 months to one where actually it's becoming a preferred route. So even planning ahead for H2 2021 and 2022, a lot of organizations in pharma, and I can rattle off whether it's GSK, Vive Healthcare, Galapagos, Gilead, and they're all now migrating to virtual digital for internal, external. Because the bit that we haven't yet discussed is that the ecosystem of venue in a digital world has exploded to another level. So the analogy I draw, a venue in the traditional, Mark could have put on events, anything from the O2, Excel, Grosvenor House Hotel, a Hilton, Jury's Inn, so they're all venues. You can all occupy them. What's happened in the virtual space is that these platforms have evolved where, subject to your requirement and capability, there are now digital venues. And so the skill is understanding which venue is most suitable for your event. Whether you want pre-registration details, whether you want people to self-serve plenary sessions, you can now do 3D avatar animation meet and greets. I mean, the experience in terms of an immersive one is phenomenal. But tracking the data of how long people are willing to, you're in a physical event, you're competing with someone's physical time in their diary to come out of an office, travel. But part of the attraction was stay in a hotel, network, lunch, dinner. And actually, it wasn't just about the seminar sessions at the event, it was a lot more. Whereas we're competing now against an email popping up in the bottom of the screen.
Yeah. So with that in mind, you talked about there's a huge scale in terms of what can be achieved. If we were thinking of a couple of specifics which would differentiate this Zoom panel discussion from, say, a virtual brand funded event where actually the brand is proud to put it on, the experience is optimized for the user. What are some of the things which people are deploying or you're deploying to make that user experience special?
Well, the key thing, this is Zoom. We're on Zoom's platform. So this is a Zoom event rather than a PRCA event. As far as the PRCA are hosting it, it's Zoom. Whereas actually the platform-based piece and some of the stuff Mark's done and we do, actually the way to plan the event, whether it's a press conference or a 2-day summit, is you start from thinking about what do you want as a delegate experience from the first invitation. What do you want as a speaker experience? And what do you want as outputs and outcomes? Do you want networking? Is it lead generation? Is it sentiment shift? And actually, because the reality is, if a digital event, you can have breakout rooms for country managers speak to distributors. You can have breakout rooms based on subject matters. You can do pre-recorded. You could do live. You could do as live. In other words, the platform is technology, and I describe it like having a Meccano set. All the pieces are available now. And the great news is, because all the raw pieces are there, you can build from the ground up in your shell. So for me, the experience stems from, do you want a bespoke, personalized, customized email invitation being sent to someone where the point they click yes, it drops into their Gmail calendar and Outlook calendar. You then have the ability to send them follow-up reminders that's tailored and personalized. and subject to who it is that's registered, every bit of content they then get is bespoke to the individual, so that when they arrive on the day, the page they land on is tailored to them. So rather than just coming into this open environment where anyone watching this could be from a variety of backgrounds, but imagine if the page they landed on was tailored to them, their own experiences, their background, their role, their responsibility, right? And then the entire user journey experience, because it's digital and data flow with AI, I could, if I know who you are, Dan, I could automatically, when this session finishes, take you through to a Q&A session that's appropriate to you based on your user profile. Or I could give you the opportunity to self-select. But the technology is there. And we all know that for events to be engaging, the more customized and personalized you make something, the better the traction and engagement rates. I can encourage you to download repository of assets. I could do moderated Q&A. So actually the questions come into a moderator behind the scenes who feeds it to me through a WhatsApp message on my, so actually there's none of this, oh, should we share screen? Oh, can you, because what you want as the viewer, the delegate, you want to come to an event that's seamless and fluid. And the production with the technology is the bit that differentiates all the way through from Zoom to one of the highest end platforms like Six Connects, which is a 3D avatar experience where you're immersed in it, you know?
Yeah, and I probably should have asked you this before today, but how do you prepare the hosts and how do you prepare the speakers? Is it like preparing them to do something on screen, or is it like preparing for a normal event with a little bit of nuanced support because the production team's going to help them?
For me, this is a crucial part because technology is great, but you want your speech, certainly in pharma, where controls, compliance, the level of sensitivity, nervousness, but you have world-leading experts. They may not be world-leading experts in technology. You want them on the day to focus on delivering what it is they're going to say. So even the management of their slides, if they've got a slide presentation, you want that done before, not handled by them. But the basics, and these are some of the basics, you check the HD camera, the lighting, the setting. No one likes looking up nostrils. Yet I'm amazed still you'll see a number of live TV interviews where people's webcams are on the laptop and they're coming up. There's some basic things, but where's the router? Is the broadband connection? What if the kids are in the house? So actually, sometimes testing it with them a few hours before, as well as a couple of days out, suggesting to them they have a backup on a 4G signal. So there's lots of the technical side you do as a backup, so that on the day itself, your speaker focuses on just speaking to camera and not worrying about anything else. That is a very, very important part in terms of the sentiment of what the delegate takes away from the speaker. Because if the speaker is a world-leading expert in whatever they are in, but is nervous about the technology, it will disrupt their flow slightly. Having a PowerPoint presentation, would it be amazing if alongside this, suddenly I just said a word and someone in the background was running a PowerPoint presentation on the side? That's the capability you have. Similar to how you'd have an AV room in a traditional venue. So a lot of those things in prepping speakers are so, because it's not just about speaker being that, it's the end impact to the viewer is completely different.
I can see, Mark, you're nodding along there, which is great. No one likes panelists falling out with each other, but I think from a kind of healthcare specialism perspective, obviously you're in agreement about that. Would you again, if you could maybe reinforce or add to some of the things Howard's mentioned about the kind of production requirements and how the kind of focus, if you're putting on one of these events, maybe drifts from being 90% messaging to being 40% production support and the rest messaging or whatever it may be from your experience.
Yeah, I mean, I think it's absolutely right. The kind of experts that we're using, as Howard said, your top cardiologist or your top rheumatologist or whoever, and you really want them to focus on the content that they're delivering, and you don't want any of the tech to get in the way. And with the best will in the world, even sort of 12 months after we all started going into lockdown with the restrictions, tech is still a problem for a lot of people, and kind of removing that barrier as much as possible makes a big difference. And of course, the user experience is important. But I think the only other thing to sort of add into the mix is in terms of in terms of media. I mean, what we're really finding is that for a press briefing, you know, if you have something it's as live. I mean, let me just rephrase this a little bit. In my experience, pharma in particular were very risk averse and very careful. And so a lot of, when they did press events online, they were all pre-recorded and it just came across very stilted. It didn't come across as being it didn't come across as being live at all. And it can be a bit boring. And what we really found, and I think this is where the tech is so important, is kind of having a situation where you can dial in and pre-record a KOL, a key opinion leader in Melbourne, Australia. And when the actual press briefing happens, you know, they're tucked up in bed, it's 2-3 o'clock in the morning. But then you've got a facilitator who is then completely live, who just gives it that that kind of, you know, on the moment appearance, which I think in the field of journalism and in the field of media is just so important. I think for journalists to feel that this is an event, this is happening now, this isn't pre-recorded, I think is really resonating well. And I think the other thing to add is that in terms of questions that we're seeing, I think in a live event, and when I say live event, I mean face-to-face, you know, journalists are people in the sense that, you know, they can be a bit embarrassed. They don't want to ask questions in front of their peers. And it's a really simple one, but just having the chat function, being able to review it behind the scenes, journalists can ask questions, and sometimes they can not worry about the fact that it might be an obvious or stupid question. I think we're finding that, you know, in the online space, in the virtual space, there's just a lot more engagement, which is fantastic.
That makes a lot of sense. We've all been at events where the microphones are getting handed out in the audience. The anticipation builds as the microphone gets closer to that person, as their heart starts racing. Maybe I'm projecting a little bit here because I get nervous in those events. But I think, you know, it can be a bit of a killer for asking questions. And you know, yet people will rush up afterwards to ask a question in solace, if you like, rather than in front of the group. By the way, probably a terrible time to mention this, but the chat is open. So please, if you do have any questions, please start submitting or prepare to do so. But coming back to what you were just saying there, Mark, about the importance of including a live element. So it is exciting. It is an appointment to view, as opposed to just watch this at your leisure on demand, which is obviously less exciting and in no way interactive. Obviously, sometimes pharma healthcare clients hear live and they get scared, particularly the legal department. So if you were going to kind of program a virtual event, which bits do you think would make sense to have as live, and which bits would make sense to have perhaps as pre-recorded? Or is that the overly?
Yeah, I mean, as soon as I start talking about compliance, we're going to start seeing the attendance figures starting to drop off, I think. So I'll be as quick as I can, but I think the moderator, the facilitator, it has to be live, and obviously the Q&A at the end, it's so important to have that live. I kind of feel like everything else in between you probably can do pre-recorded. And I think the great thing about the pre-record, and this is where the compliance bit comes in, is, you know, the fact that a lot of other, you know, parts of pharma who aren't dealing with the media, who are very nervous, the fact that they are being told, okay, we're filming this key opinion leader, or we're filming this patient, or we're filming this expert, and you can actually review exactly what they're going to say before it then gets broadcast, has just made a massive difference, and has meant that we've been allowed and able to do a lot more. And I mean, I know we'll probably talk about it in a bit, but from a sort of future looking viewpoint, I can really see, and I hope that pharma really kind of embraces it and keeps that kind of upward trajectory going. Because I think, coming back to Rachel's point at the beginning around trust, you know, and trust in healthcare, I think that the big problem with pharma in particular is just not engaging enough and not communicating enough, and almost being a bit too sort of too closed off and too careful. And I'm really hoping that even if something's pre-recorded, it's better than nothing at all.
That's great. In fact, that was going to be my next question. I think we've kind of acknowledged the fact that broadcast consumption has been affected in a big way by the volume of people no longer commuting and working from home. I think it's fair to say, and Howard, Rachel, if you disagree, please do, we'll see a slight reversion to what it was like before the pandemic, when and if we do come out of it. So roadmap permitting, with people, whether they're just doing 2 days a week, 3 days a week in the office, or 5 days a week back in their workplace, we'll see the breakfast peak listening come a little bit earlier again. We'll still have a lot of people listening throughout the day. Obviously, TV news will still be a crucial source of information. It's interesting, Howard, do you echo Mark's sentiment that a lot of the adoption of virtual events will be habituated, and therefore people have had their eyes open to the benefits of such a thing and will therefore continue beyond, say, this year? Or do you see a bit of a kind of reversion to what things were like before the first lockdown?
I mean, it's a bit of a fashionable reference term at the moment, but it'll be hybrid. So all the brands I'm speaking to at the moment, there is a very obvious appetite to try and have some form of physical in some capacity, for so many reasons. But at the moment, all the metrics and evaluation models that come from digital and virtual give evidence to the effectiveness. So the challenge at the moment, and again, the tech is already being developed, is how do you take a maybe slightly smaller scale physical moment in time and combine it with virtual digital experience? That's the norm. To me, that is the norm. That will be the norm. And I think it's just a question of the types of technology and how people will keep up with the technology, because the brand appetite is there, the organisation, stakeholders, and I actually think I think events that take place within a certain territory, within a certain country, the physical will happen a lot, the attendance will happen a lot quicker. I think the flying around the world piece will be the challenge. And I think that's also because of carbon footprint as much as anything else. But to Mark's point, the accessibility of key speakers who are very time poor anyway, to not have to travel.
Yeah.
And what you've seen, what translates, we call it the Netflix generation, convergence media. But people, when they're watching Netflix on TV, don't think to themselves, this is not coming via satellite feed. They're watching telly still. They're less consumed in wanting to get an understanding of how's this being delivered into my home. And there's also a lot of people watch it on a laptop and on a tablet and on a smartphone. So it's the technology efficiencies, the better the platforms evolve, plus the metrics, means it's going to be very hard for organizations not to still have it in the suite. Mm-hmm. But I'm not naive to think, listen, I'm looking forward to meeting people in person, but will I travel less? Yeah. And that's the model. It's the pandemic. One of the positives, if there is the acceleration, the adoption of the technologies.
Yeah. No, it makes complete sense. Mark, Rachel, anything to add to that before we open up to questions, if there are any, from our viewers?
Yeah, I mean, I think the only thing from me to add to Howard's point is a lot of what we do in the healthcare, ethical, pharma, comms space is driven by what medical congresses do. And obviously, in the middle of a COVID pandemic, what you don't want is a whole load of healthcare professionals who could be helping back in their own countries, flying over around the world and all getting COVID. So I think it would be very interesting to see, what does this hybrid model look like? I think a lot of these medical congresses will do hybrid models. I'll be interested to see how that works with press briefings, and how do you do a hybrid press briefing so that both the face-to-face and the virtual still have a very visceral, real experience without it feeling too, toned down on both sides. So, yeah.
If you can imagine the number 10 briefings, but with a select number also in the audience. right?
There we
So
go.
we watch the number 10 briefings on Sky News or BBC, whichever channel is or you might stream it online, and you'll see your key opinion leaders, for want of a phrase, the three of them, whichever three, will stand at the front. You'll see questions that were pre-recorded, pre-validated and self-selected coming on the screen to the side. Everyone knows what's coming. Add into that some physical people in the room, and then the technology for the viewer to be able to interact with all. That's the hybrid. The key bit for the viewer is how would I... So if Beth Rigby comes in on Sky News asking Matt Hancock a question, the technology now exists that if I'm watching this virtual, I can still network into Beth Rigby and ask her a question. That's the hybrid model.
Interesting. Literally that breakout type coffee room scenario if it was a physical event. Thank you, Susan, for the question that's just come through. And well, first of all, thank you, the panelists, for that excellent discussion, and thanks for staying on for these questions. Susan's asked, at the moment, that health news is obviously dominated by coronavirus, but do you have any thoughts or, I guess, advice on how to cut through with other health stories? I think, Rachel, you mentioned the campaign last week, which I believe was non-coronavirus related. H, you're nodding away. Whoever wants to take it, please.
Thanks, Susan. The fascinating thing has been that, normally there's one space in the news agenda for a health story. And part of the challenge over the last 18 months is that's automatically been taken by some massive government announcement. So it's absolutely the right question to ask. A number of things that we found in the campaigns that we worked on, and especially the campaign last week, given that we had the competition with the budget and the royal family and all of those kinds of things as well, is one, it needs to be news. So there has to be content in there that is new, that is engaging, that is saying something that isn't already out there. The other thing that we have done with that is we need to make it actually relevant to the top story, which is a COVID news story. But we found that that hasn't necessarily been the case throughout the pandemic, because sometimes people have wanted to change from COVID, or there's kind of been this sense of wanting to give the nation something more uplifting than perhaps another kind of scary COVID story type thing. So definitely there are ways to cut through. And I think the big thing is that ultimately it needs to be news. You need to have some great data, some great spokespeople. I think we've all referred to spokespeople. Mark referred to it in relation to the live events. Howard referred to it in relation to what he was talking about, but the spokespeople are absolutely critical. Investing in them, making sure that they're well trained, they're prepared for the media, they're on message, and alongside the case studies as well. So Howard, I'm sure you'll have other things to add.
Yeah, and I'd also add that I think that's true with consumer health, but from a trade perspective, I mean, I think healthcare trade, I haven't noticed a huge difference. Obviously, coronavirus has dominated there, but the trades, so the niche publications, are still very, very, very receptive. So, you can still place stories if it's specific for that healthcare trade. I would say just as easily or with difficulty as you would pre-pandemic.
And Howard, from a broadcast point of view, Rachel's talked there about the assets which are needed to cut through in terms of the broadcast news agenda. So it's spokespeople, it's news, something new to say. Do you have anything to add to that, either from an asset point of view or maybe from a tactical point of view? Yeah,
I mean, if it's UK, well, if it's global, it's a different requirement. But if it's UK specific, at the moment, healthcare is way up top of the agenda, not just COVID. The tertiary things that come out, mental health, you name it, diabetes, cancer treatments, So there's an agenda ready there waiting. What I would say to you is there is almost like a three line whip edict amongst a lot of the BBC and some of the commercial, lift spirit. So in healthcare, if you've got a story around, no matter what it is, if you can find the route to talk about how the future will be better for the community, you are in. And that at the moment is winning, because you'll get a brief in healthcare, you'll look at it and say, treatments are down, your NHS are trying to get people into this, that. Right. That tone won't land. Yeah, you might get some of the BBC on a national level because the BBC will bash it and the terrorists say, healthcare services in dire straits, actually, you go around the country and you look at a lot of the regional media, which has impact for trusts and the like. Actually, if you've got an angle and a narrative or a case study and something to talk actually, but the good news is, moving forward, this is positive, or there is light at the end of the tunnel, which is the terminology that's being used by them all. You are in, because there is an agenda amongst the media in broadcast to lift spirits now. So my advice would be, whatever you're working with, whatever constraints, try and find that. The local, case studies would always be your strongest advocacy in terms of opportunity. BBC Breakfast, get me on the sofa, I'm in the virtual world. Give me patient type thing, and KOL. They don't want celebrity, unless the celebrity has had the condition or there is a direct correlation and the reason why. Forget the celebrity route. Not that you would, not the individual instances, but just focus on the core assets where the tone of message is, but light at the end of the tunnel, moving forward, good news for our community.
Yeah, that's a great call. I think we definitely noticed over the last 9 months, there's enough bad news around that actually, if we've got a positive story to tell, whether it's some kind of breakthrough, happy news story, new drug approved, something like that, which is going to help people, then yeah, that definitely gets cut through. Yep, Susan said thanks. Yep, absolutely chimes with her experience. Any other questions at all from our guests today? Thank you again for joining us. I think just one thing to add, whilst anybody ruminates on what they might ask, again with that in mind, is again just understand who you're pitching to. So yeah, to understand the experiences of the presenters. So yeah, we focus very much on news, but actually daytime, breakfast, drive time presenters, if you understand what their circumstances are, their family connection, can you look at their social, what have they talked about in the past, what are they potentially energized to get behind as a campaign or as a story when it comes to health or anything else, then that can be really helpful. So we obviously, as broadcast specialists, we do a lot of broadcast listening to inform those kind of decisions, but if you can do that at smaller scale, then that's a great way of obviously crafting your approach to make sure it lands and gets captured.
Just one thing I'd say, Dan, is that recognise that a lot of the broadcasters have resident GPs, resident health experts. Don't fight, don't compete against it, go with it. So think about your route to market for coverage, maybe actually to get one of the resident GPs, resident health experts to talk your narrative. The other thing is, there was something recently where on the number of health apps that are coming to market, the briefs we see of this is the next best health app, this, that, and the other. But there was just one of them used a spokesperson who was the previous chair of the Royal Society for General Practitioners. Landslide coverage. Just relevance of a spokesperson who can relate to frontline what it's like in their health service. So again, just think around the asset. There needs to be a strategy to land the type of coverage you're looking to achieve. And all I would say to you is just reverse engineer it. So if you're trying to land ITV This Morning or a G&B or a BBC Breakfast or a Channel 4 News or the regions, the BBC Regional News has more people watching that than any other channel in England at the moment. So in terms of mobilising the behaviour, so if I want BBC Regional News, what do I need to have in my asset pool to land it? Where's the authenticity? Where's the data? So again, just to reaffirm for everyone, to have a regional and a local broadcast license with a TV or radio, you have adhered to actually Ofcom regulations that a certain amount of output will be regional. So even if you've got data, just use that data to help segue you into the regional news bulletins.
Thanks for that, Howard. Question just coming from Eleanor. We're going to squeeze in before the hour's up, if that's okay. Thanks everyone for their time. Eleanor's asked, have you found that healthcare technology is also in demand? I'm presuming as a topic of conversation, so long as it has a positive impact. So I guess building on what we were just saying, or you were just saying about the importance of positive stories, so is that particularly applicable when it comes to health tech? Yeah,
but you need to be honest. And where I say that is the number of health apps launching that claim to be, this is the thing that's going to make, this connects with your GP records, it's going to, it's going to save the NHS millions. Everyone's coming with the same story. This health app is going to revolutionize the way we live. So there is absolute appetite But the key thing is to think, well, why is this one slightly different? And this is where you go back to the asset value. Because the moment you struggle to differentiate between these apps, just as a lay person, you know, whether it be booking appointments, self-diagnosis of simple things, but what are the assets you've got available? So the media have absolute appetite for it, because the positive news for the community is it frees up NHS resource. So you need to talk about why this is a benefit to the community. But what are the assets available? And this is where, you know, I would say, you know, the individual I mentioned before, who was the chair of the Society for the GPs, perfect. Where sometimes brands will turn around and say, oh, we've got ex-athlete, this Olympian, talk about, you know, you're trading on the talent. Not all media are going to be interested in talent.
I think as well, Dan, taking it back a step, because healthcare tech, one of the things, whether or not you're talking about apps or whether or not you're talking about innovation and medical devices as well, knowing the product or the company that you're working for and where they're at and the stage of their journey. So who do they actually want to communicate for, and why do they want the media coverage, or do they want to do the campaign? Do they want to do it to raise investment? Do they want to do it as a launch? Do they want to drive downloads? So going right back to basics and understanding where that organization is at in its journey is really important, because we've done some great stuff with some medical devices where not only you can obviously take it through and you can do the whole broadcast piece, but equally doing live events with healthcare professionals where you're allowing them to have a conversation about it, talk about the difference that piece of kit or that technology is going to actually have, and the impact on a patient perhaps with the condition that it's going to help support, is another kind of big thing that you can add into kind of your toolkit of tactics when it comes to broadcast. So it very much depends on the health technology, where it's at, and the scope and the scale of it as well.
Brilliant. And we're just about out of time. So Mark, anything else you wanted to add to that, or any other kind of summing up comments from your side? No pressure if not. We've
no, I think I think from the only thing from a healthcare tech perspective is and it probably flies in the face of what Susan was saying a little bit, but we've sold in a couple of stories, health tech stories, and having the COVID angle, just consider the COVID angle and how the healthcare tech will assist that always helps get coverage.
Absolutely. If there's a relevant link, then absolutely use it. Good advice. Eleanor, Susan, thank you so much for your questions. Howard, Mark, Rachel, really appreciate your time this afternoon.